The United States has one of the highest rates of incarceration of any country in the world, with 2.3 million people in prison. Paul Redd, born and raised in Oakland, California, was wrongfully incarcerated for 44 years, over 30 of which he spent in solitary confinement. While in prison, he wrote poetry, became a jailhouse lawyer supporting fellow inmates, and organized massive prison hunger strikes across the state.
I became an advocate for prisoners' rights. I was a jailhouse lawyer. I filed a lot of grievances, writs for prisoners who was having problems with advocating for themselves. So I was committed to doing that. I was involved with 3 major lawsuits that helped change the conditions inside the prisons. And later on, I got retaliated against by being placed in solitary confinement for a number of years. And a lot of us solitary confinement always knew that if we wanted to change the conditions of prisons, we had to come together. For the main reps, they decided, hey, we need to do a hunger strike. Prison officials, we knew they weren't going to respect the hunger strike because we was isolated in one quarter. They called it the short quarter D facility. That prisoners need to come together, so we created what you call in the hostility. So we went to the third hunger strike. 30,000 prisoners supported it. And that goes on and on. And then, fortunately, I was able to get out on the 1170 through Chester Bodine. And once I got out, it occurred like within 45 days. I got out, fast track, So then I had to start all over trying to find out where to go get dental care and all that. It was like getting a runaround. So finally, I told a friend of mine, Morgan, about the problem. Next thing I know, she made some contacts, and that brought me to you. Yeah. And it was a pleasure coming here because once I came here and told you my story, it told you how frustrating it was going through this medical, this Medi-Cal. You told me your story about how you trying to help people. Sure. You know what I'm saying? And I'm like, wait a minute, well, good, we can do this together. Yeah. You know what I'm saying? Because you got people formerly incarcerated getting out. A lot of people got a lot of dental problems. They're insecure, lack of confidence. I said, the work that you're doing is helping restoring people confidence in society so people can get out and contribute to their community. So that was a good thing, and I'm kind of glad that we had met, and that was how I came about creating Fire, and put that flyer out about that, and a lot of people liked that flyer, they said, what does Fire stand for? Fire stand for formerly incarcerated, the impact, restoring people back to society. Sure. Formerly incarcerated, requiring empowerment. Empowerment, and bringing people back out here. And that empowerment is being able to have good health care, good dental work, etc. Because you're building that confidence, what people need, where they can go apply for jobs. Sure. Where they can go and get jobs and be able to say, hey, man, I like what's going on. Let me help contribute this to the community. And rebuilding our community layer by layer. So that's the importance of that empowerment, having that to do that. And again, also, that's how Ruben Williams, who here today, he done 44 years. Same way, being frustrated with the system, the Medi-Cal system. So we're very committed to getting people to where they can function properly. And I'm a dentist, so once I found out there were fellow human beings, regardless of their situation, homeless, veterans, seniors, formerly incarcerated, that were not being served. And the system was broken where, yes, we have Denti-Cal,
As you know, they cover some basic services, which is great. We need that. But a human being needs a little more than that. You can't just do A and B. You need to go all the way to Z so that you can function, that you can have a smile, that you can eat. Right? It's a basic part of what we live. And obviously that's so unique that you use that force of eating, or in your case, not eating, to create massive change. And I want to do the opposite. I want to empower people to be able to eat and socialize and spend time with their loved ones. Because at the end of the day, that's all what it's about.
We want to give you guys the best care. And to do that, we need the best supplies, the best team, so that we can give you, your confidence back. You're all trying to get jobs and stuff, and you want to have a beautiful smile, and I want you to function, eat, laugh, smile. It's all super important.
Well, the impact that we have goes beyond what just happens in the chair, right? So yes, we're fixing their teeth, but what that allows them to then go out and do is, different job opportunities, just a level of confidence they didn't have before, ability to, partake in social gatherings and all that. And, one thing we want to touch on is a lot of our patients are on state dental insurance, they have Deni-Cal, and so the conception or misconception even with Deni-Cal is that all the work is covered. And a lot of patients assume that all the work is covered, but that's not completely true. So a lot of the major work that needs to be done is often not covered.
With your support, Just Health 510 and the FIRE Project can expand and serve more people like Paul. Fund a smile, fund a fresh start. Please donate today at www.justhealth510.org.